My name is Norma O'Keeffe and I work as an advanced nurse practitioner in one of the children's hospitals in Dublin. And I have been looking after children in paediatric rheumatology for 22 years at this stage. When I was first asked to help at a monthly clinic, I really didn't know almost that paediatric rheumatology was a thing, but I was very fortunate that I worked with an amazing paediatrician who was quite passionate about patients with JIA and other rheumatology conditions. And I think that's where my passion, and I also work in, my role is split 50-50 with pediatric rheumatology and also chronic pain or complex pain as we prefer to refer to it. And today I was asked by Wendy maybe to talk about helping children cope with injections. And I almost felt that everything I'm about to say, I think you will probably know it already, but let's see what, and I think somebody like Jasper probably has more to offer maybe than I, because I've certainly learned something like, maybe from my listening to you, I have found that maybe some of the advice I give is maybe redundant, but let's see how we get on. Okay, so we know that fear of needles is a widespread phenomenon. A UK study showed that 25% of adults experience intense fear of needles or injections. So I wasn't the only one in my 20s who avoided going to the dentist because I didn't like needles, which some people find interesting that I'm a nurse and I don't like needles in myself. Anyway, 63% of young people between 6 and 17 also have a fear of needles. Maybe you know this already, but it was news to me. Trypanophobia is actually the name given to an overwhelming or extreme fear of medical procedures that involve needles. And the anxiety associated with needles and injections are really real and can have a significant negative impact on your child's life, leading to increased stress and sleep disturbance, not only for the child I'm very familiar with, but also for many parents, every time they have to do an injection or a blood test. I left to come here on Wednesday. On Tuesday, I had a phone call from parents who their daughter has been on methotrexate for many years, and now they're running into difficulty. So I would say on certainly a weekly basis, some parent will tell me about the struggles they have with either injections or bloods. Occasionally, it results in children missing vital medications, treatments, blood monitoring, essential procedures such as joint injections if they are needed. And these are designed to reduce disease activity and overall improve the quality of life. However, on the other side, if it has such a negative impact on their mental health, well, maybe we need to relook at what we can offer. I also just will quickly go over maybe the role of a nurse, and I said this yesterday, I'm very conscious that within a European setting and wider, that the role of the nurse is very different, it seems to be in different countries, and that the regulations and maybe the scope of practice is quite different. Broadly, I would say that throughout we support children and young people, particularly at diagnosis. So for me, anytime there is a newly diagnosed JIA patient, I will see them, the child and their family, for maybe an hour or so. So we now schedule this into my clinic, that it is normal, because maybe the consultant will have many patients to see. So rather than a parent feeling maybe hurried that the waiting room is full of other parents, so then it is easier, that is maybe more relaxed, and they have time maybe to explore or ask questions. We try to be a source of knowledge, as parents often experience confusion, emotional turmoil, feelings of guilt, anxiety, frustration. And again, I give an example that comes to mind was a mother recently whose child of 13, 14 was newly diagnosed with JIA. But she was feeling really guilty because her son had early morning stiffness in his knees, and she thought it was something to do with his school. So she was saying, come on, because she knew that 30, 40 minutes afterwards he was okay. So she had worked out in her head, and she had not noticed the swelling, which can happen. But then she had this incredible feelings of guilt that she had left, that now maybe there was permanent damage to her son's knees, which thankfully there wasn't. But I fully appreciate the difficulties that parents and young people face. We try to provide ongoing education in relation to treatments and therapies. And again, this can be, you all have access to Google and other, platforms, maybe parent support as well. And that sometimes, which is quite, parents will have questions about medications that they've read about in different places. And again, where I work in Ireland, we very much, I would say maybe a quarter of the patients that we would see in our clinic, their parents were not born in Ireland. So they come from different parts of the world, whereby they will maybe go back to their local clinic when they are home for a holiday, and they will come back with questions, maybe where they come from do things differently maybe than we do in Ireland. The other piece and also I discussed the challenges and problems that children and young people face, and see if we can offer solutions. As I'm very passionate about minimizing pain, I will always try to address this, particularly where there is difficulty maybe in a child's function, that they're struggling with sport or maybe social, being out with their friends or school. And then obviously it's not me on my own. I work with a great team. We have a doctor, a physiotherapist and myself, and then we have access to a psychologist and an occupational therapist. So it's not just me. And also the fact that we try and do this, offering that emotional support, I think, is something that's really key, and linking in with maybe others like that, football coaches. Maybe sometimes I hear from young people that their coaches either want them, you're either playing and participating fully or you're not. And that sometimes maybe they need to learn that, okay, they just need maybe try 15 minutes. It's so important, I feel, for young. Again, I am a mother of 3 daughters, and I know how important it is that they are involved in sport. And, it's a place where you get to meet your peers. And in preparation for this talk, I came across this paper, which I feel is very relevant. It was Human et al., and it was entitled Struggling in the Dark to Help My Child. So this was a study that interviewed parents on their experience of dealing with a child with JIA. And as I read it, I thought, this is so true. This is what I see on the other side of the desk of parents, whereby they don't know what or how best to treat JIA, because the treatments that work for one child don't necessarily work for the other. We are just so overwhelmed at the time that we can't even process all that information. Again, this is something, I say this to every parent who come in that are newly diagnosed. I can give them so much information, but I know that probably 10% of this they will retain. So I expect lots of calls and maybe emails to I'm not sure if you mentioned this. So I expect a lot of time I expect that I will be spending a lot of time with this family at the start, and that maybe as they get more comfortable with the disease, the medication, etc., I hear less and less, and maybe it's only every 3-4 months when they come back to us in clinic. Obviously, the parents find the most challenging part is probably medication, making sure that they are doing it correctly, and then they have to deal with the side effects. Every time you're doing that injection, you're pulling all the tricks out into your hat, and your child is not responding, and you still have to give that injection. Holding them down, or like you force it onto them, it's traumatizing. So I think for many of the parents in the room today, this is familiar. And again, these are much the same as what I had said. The findings were the not knowing, the reaching out in the dark, trying to work out the kinks to stay on top of this condition, feeling your child's pain, feeling drained by the whole process of the disease, the treatments, etc. And that it not only affects the young person with JIA and the family, but also the siblings that are in that family are also feeling affected by this. So, practical tips. This is the part where I felt that possibly you will all know this already, and that maybe there is very little new in it for you, but being honest is probably the first thing I would say to parents, is explaining that injections can pinch briefly, but it doesn't hurt so long. again, discussing coping strategies, and this has to be done maybe in advance so that it's not something that you're doing if you're giving methotrexate, at 6 p.m. on a Friday evening, that it's at 6 o'clock that you're working at, you're coming up with strategies. And again, I ask parents, and I'm always conscious that it's easier for me, but trying to get your child to focus on the benefits. And I know that's not easy when I can see nodding going on, yeah, we know this, is that the good news is, particularly I find with, maybe less so with methotrexate, but more so with biologics like Humira, is that very quickly, most of the patients I see a response really quickly. So parents will tell me, after 2 injections, oh, my child is much better. They're not stiff in the morning, they're able to play football for longer, so therefore it's easier as parents then to win with these injections, whereas if a child is really struggling to see the benefit, it becomes more difficult. I will go into each of these in a moment, keeping your cool and using coping strategies. So this was one of the things that I have come across, is creating a fear ladder. So therefore, it's almost as parents that you are setting out, what are the issues? So is it just the methotrexate injection? Is it also having to have, when you're on in Ireland, when children are on methotrexate, they also need monthly bloods. So that's another challenge for many parents. Even the fact that if they need a joint injection because maybe there is a lot of fluid in joints, that we also need to schedule in a visit into our day ward. So that's a lot for a young person to have to cope with. So maybe it's a piece of scheduling, okay, what is the worst? What is the thing that's worse? And then working on the easier ones and bringing it down. Breathing exercises. And I think I've started to do a diploma now in positive psychology and lifestyle, and one of the talks on meditation. I think we can all lots of us healthcare professionals tell patients, oh, you need to practice mindfulness or meditation, but I wonder how well we do it ourselves as individuals. And as I read recently, it's like a sport, all of these, and there is lots of practice. So it's not a case of just before you're about to do an injection that you say, okay, you take 5 deep breaths and on you go. We've got to practice like you would with football or golf, whatever sport you're into. And the other piece I would say is it really has benefits. So once it takes time, and sometimes it feels like, oh, I'm not really, I hear young people say, oh, I'm not really good at breathing exercises. But then whatever they do, whether they play piano or football, I say, yeah, but can you play Mozart after the first piano lesson? No. Well, this is the same so therefore the more we practice, the better we get. And I am trying to also do this myself, that when I feel a bit stressed, that I'm now practicing particularly that breath work. And it's not, there is so many resources now available online, YouTube, Spotify, all of these have lots of these already available. Pain blockers. So this is an area that I'm asked a lot about. And I'm sure some of you may have, I don't know if the parents here have tried maybe some of the numbing creams that are available, like Amitop and that. There was a time where I recommended it and we used to give it to parents. But then we learned that for the 30 minutes, once that cream was applied, my experience or the feedback I got from parents was that this then became 30 minutes of hell. That now the child knew that it was almost like the countdown. So then my experience has been, I think it is better not to put them. It's okay maybe for taking some bloods if they have to go to get their bloods done. But as regards a weekly injection, or I'm also aware that some of our children who are on anakinra have to have this injection every day. But also maybe I sometimes think maybe something like an ice cube or one of those small little ice packs, just putting it on can help. Things like the Buzzy Bee or the shot blocker can also help. I'm not sure we have shot blocker. I think you can order it on Amazon, but Buzzy Bee, I have certainly come across some parents who will use this. Tuning out. So this is probably much and all as I give out to lots of teenagers who come into clinic about turning off phones, particularly at night where they struggle with sleep. But this is where technology can really be our friend. So I see it all the time whereby, parents know maybe something with YouTube or their favorite cartoon, And equally maybe with young people as well, maybe scrolling onto something that they like. Very often though, and I'm not a psychologist and I know there are some in the audience, they will be obviously better, more knowledgeable about these things, but very often it's doing something active rather than passive. So where the brain is focused on actually doing something, so maybe it's a game, you know, that you have to focus on, I'm not the best on these, but something like that where the brain is you're trying to win something or get to another level is better maybe than just sitting back and being more passive. The other piece is on our pain team we have a music therapist, which has been really interesting. And again, there's a lot of piece about using every young person I think I've come across has a Spotify list, so maybe there's a piece about, as part, I'm not saying it's going to cure things, but almost that there is that music, whatever it is that you will use to help you during that period that is just for this. The other piece I remember being asked long ago, many years ago when I did sessions like this with ICANN, was parents asking about doing injections at night when the child was asleep. Yeah, absolutely not. Again, I'm not that person. I understand it's difficult, but I think the trauma, once the child realizes that there's, you know, if they wake, it's not something I would recommend. Equally, I think it's not a good idea to be holding your child down. Ideally, again, it's easier for me, I'm not the one in it, is sitting the child on their lap, holding them, hugging them. What I do in clinic always when we are at new diagnosis, I always have training pens, so there's no needle in them. So every time we are about to start a child on methotrexate or Humira, even when we are just considering it, we have, you know, a decision has not been finally made, I think it is better that I start talking about it at this stage and we practice. So it's almost like the idea there is no needle, it is just what it looks like, the technique, and whatever parents are there and the young person get to do it on, you know, I get the young person to try it on their parents and vice versa. So I think this may reduce some of the anxiety in relation to the needle itself. And then, of course, we get to a stage quite often whereby we have tried all of these, and I think then this is where referral to one of the psychologists on our team, or we also have a specialist nurse who is really, this is what she does, is in relation to children dealing with needle phobia, because of course it's not just children with JIA, children with diabetes, many other conditions also have similar challenges to what you face. And things like CBT, I'm sure this is what you had, Jasper, in relation to the foods being yellow, that they can be really helpful for parents, or for young people and their parents in coping. Finally, this was produced last year, the Lancet, a big team under Professor Chris Eccleston in the University of Bath have published a paper in relation to pain. And I think it's really pertinent that we bear this in mind, that it's time that we make pain, for all of us in our consults, that it's up there up front. We make it matter, we make it understood, we make it visible, and we try to make it better. Thank you very much.
Thank you, Norma.